All right, good morning or afternoon, wherever you're joining us from. I'd like to introduce you all and welcome you here to FNU for this informational session. I'd like to introduce you to Dr. Cara Jefferson, who is our director of the DNP program here at FNU, who'd like to say a few words before we get into the quick presentation.
Good afternoon, everyone. Thank you for coming. Thank you, Dr. Couch, for hosting and doing this session on my behalf. Um, Welcome to Frontier. As we go through this, we'd prefer if you have your microphones muted while Dr. Couch is presenting, but there will be several times during the presentation where we will have Q&A. And then we'd like for you, it's easier for us if you actually unmute your microphone to ask us the questions. But of course, we always have the chat feature. So again, thank you for your interest in our DNP program.
Thanks, Dr. Jefferson. Well, just real quick, just so we got a small group, can you guys unmute and just tell me where you're coming from and where you got your APRN degree?
Wake Forest, North Carolina, and I just graduated FNU.
Beautiful. Welcome back. Richard?
Oh, hello. I'm here on behalf of the admissions team. So I'll be
Oh, your
assisting with the
admissions.
chat.
Okay,
Yes, miss. Yep.
beautiful.
Mhm.
Thank you very much. Hanel?
I am from Charlotte, North Carolina, and I am actually currently in the midwifery program at FAU.
Beautiful. You're trying to figure out if you're just going to go straight through. Well, you guys are
Yes.
cold up there. Whoo, I'm sorry. I'm in sunny Phoenix. We're 80s.
Oh, must be nice.
Carly? Kusanya?
Good afternoon. I am in Wilmington, North Carolina, and I
Ah,
just graduated, I think June. It's been a lot. Just graduated in June.
here from FNU?
Yes.
Oh, good. Well, we got a lot of people here who've been here before and kind of know the culture, so that helps. Let me grab my slide deck and we're just going to go through real quick and I will be happy to answer any questions for you. And if I can't answer them, I will get back to you with the answer via email. Um, since all of you are coming from being at Frontier Nursing University, I'm glad to welcome you back. As you know, it's just a culture that is amazing, and our students often return to us. You met Dr. Jefferson, who is our program director, and I'm Dr. Kimberly Couch. I am the course coordinator for DNPH 50, which is the beginning of the courses for your project. Just to review, our mission is to provide a high quality education that prepares nurses to become competent, entrepreneurial, ethical, and compassionate nurse midwives and nurse practitioners to work with all people with an emphasis on rural and underserved communities. So why FNU? Those of you who are thinking about returning have already experienced the quality and the beautiful education that you get with our very fantastic background and history. So you probably already know why FNU, that's why you're coming back. Why get a DNP? Well, it's the pinnacle of your education, right? Is that terminal degree. You all are so close, having got through your APRN, CNM degrees, and it's just a little bit further to get to that end. It is going to allow you to participate in academia if you choose to do that, to go into academia. It also prepares you for leadership. This is about truly becoming a leader in your fields. You're already there, but this is going to kind of put the cherry on top. DNPs are actually about nursing practice, and that is about right now, real-time quality improvement to make things happen within your organizations and institutions to better outcomes for patients. Uh, PhDs, however, are research-based and are looking at future um, ways to approach healthcare that can take years, if not decades, to actually implement. You would already take what we know to be evidence-based and use those current guidelines and recommendations and put them into place and to make your care better that you're serving your people with. So a little more gratification right off the bat. Programs of study, we welcome all of our FNP, our psych NPs, nurse midwives, nurse practitioners into our program once you meet that admission criteria. The admission folks are here to answer any questions about that, and we'll go a little bit over that as we go through the program, as we go through this slide deck. We will talk a little bit about your DNP project idea or how to come up with that idea. We're going to talk about how to get started, and you will have some professional advising as you move through the program. As you all know, you're coming to a culture of caring, and that is something that is ingrained not only as a student, but it is ingrained in the culture of our faculty, our staff who service and support the students. It is what we are. Your home community becomes your classroom. Your projects are actually done in real time while you're working at your clinics, facilities, institutions. We want you to really make better care where you're at for your patients. As you know, you can study from the comforts of your home, your time, anytime. You do get to travel to beautiful Versailles for orientation and in some cases virtual orientation, depending on where you're at in your programs or if you're a returning student. And if you've never been to Kentucky and the new campus in Versailles, it's absolutely beautiful. There's some pictures for you of the new organization, and just if any of you were at the old school in Hayden, Kentucky, where we were really in tight, cramped spaces, they've managed to bring that wonderful feeling of community and history here to Versailles, and it was a nice transition, so I think you'll be happy. We have 100 years of experience in the nurse midwifery and family nurse care programs. Students and alumni represent every state, every United States, and many countries across the world. Over 10,000 graduates and our vast experience in online education. We were not fazed by COVID at all. We had it down. FNU Achievements, the Higher Education Excellence Award in Diversity. We've been cited as the great colleges to work for and recognized for consecutive years. And I can truly attest to that. It is a fantastic place to work for if you decide you want to go into academia after you've completed your degrees. We received the AACN 2023 Award for Inclusive Excellence, Belonging, and Sustainability in Nursing Education. And we were named the Academic Honoree for Healthy Work Environment Award by the Sigma Theta Tau International Honor Society. Now, as far as student support, many of you have already experienced this, and it gets a little more intense and one-to-one as you get into the DNP program. We not only have online student support groups, but we also have student-to-student support groups. You will be assigned faculty mentors once you get into the project faculty, and those faculty mentors will actually stay with you through the final 3 courses of the program so that you have the same and consistent people offering you mentorship and guidance through your projects and QI initiatives. There are financial aid officers. Library services are absolutely fantastic as well. And there are student interest groups to help support your any special interests like the VA. There are um, military groups. There are um, uh, language based groups as well. So you will find pretty much anything you're looking for within the student interest groups, and we encourage you to join those and to become a part of that. There is a student council as well. Dr. Jefferson is the program director. You will have course coordinators and course faculty, academic advisors, financial aid officers, credentialing coordinators, and IT specialists who are all very dedicated to the DNP program and are well versed in problem solving and solutions and helping with your very specific needs in the program. So why get a DNP? It's average 17 years to implement new knowledge in clinical practice when you're working like in a PhD program. Any kind of new research takes so long to get through that whole getting it through approval and through all of the governing bodies. Uh, you will be able to develop expertise and to lead and improve care in real world implementation, like right now. Take an already established standard of care that maybe you're not doing quite so well with in your organization, and let's bring it up a notch and bring you up to true evidence-based practice. It is your terminal degree. You can be thankful that you're all done. DNP admission requirements in the criteria is that you must hold your MSN, MN, or MS in the nursing or related field. You must have a current active registered nurse license in the United States with no encumbrances. You must be certified as a CNM or NP. You must have a 3.0 GPA, and you will have a background check. Now, one of the caveats to this is many students can do their projects as RNs while they're waiting for a job in the NP field or as a CNM. Sometimes the turnaround isn't as quick to get those jobs. So to keep you from having to stop and take a break if you don't want to, you can do your projects as an RN as long as we're already graduated. Postmaster's DNP programs of study is 30 credits long, 18 months, 6 terms. The actual project courses take place in term 3. As you know, from being at FNU, there are 11-week terms with 2-week breaks in between each term. And just so you know that there are mechanisms in place because life happens, right? And sometimes we have to step back, take a pause, attend to events that are happening in our everyday lives. And Frontier recognizes that. And we have things in place to be able to support you to get back in if you have to take a pause or a break. So never fear, we will work with you about making this comfortable to fit into your life and those situations that come up that are unexpected. You will have didactic courses, and these courses are leadership courses. Basically, they're going to help you to develop as leaders and apply when we get into the project courses. You will actually be able to apply and utilize these things that you're learning in these didactic courses. So they are amazing courses. Many of our faculty have gone through them, and you will learn a ton to help you become leaders in your organizations. And so every course is just phenomenal. Your DNP project courses, there are 4, with the last 3 being absolutely dedicated to your project. 850 is a prep course, which gets your site credentialed. You have to go through credentialing similar to when you did your CNM APRN credentialing piece. We make sure that you have liability insurance and all those things going into this. And then you're ready for 851. We can talk a little bit more at the end in the Q&A session about your questions about your sites or anything like that coming up. 851 is where you actually gather the evidence to support the need for a project. We have to have a baseline established so that we can prove improvement. 851, you will plan your project. You will gather the data through auditing patient charts, patient surveys, surveying your staff, meeting with your staff to get to the root cause of why we're not doing something as well as we should be. You will come up with your interventions that you will implement the following term, and you will determine the measures on how you're going to measure success. 852 is the actual implementation course where you will begin implementation in week 2 of that course, and for the next 8 weeks we'll do what we call plan, do, study, act cycles of implementation, making small tests of change to improve, to get to your desired outcomes and your desired goals. 853 is where we get you ready to disseminate your information, and this means you will write up your final paper, and it is essentially helps you to get ready for publication if in fact that's what you want to do. Many of the journals and things require different things. So this is just a good baseline to get you ready to publish if you need to be or want to be. You will end up with a podium presentation, and you will actually present that to your organization or to your clinic, and faculty will attend so that we can hear about your successes. You will end up with a poster presentation that you can take to your conferences that you're interested in or apply to your profession, so that you can disseminate and share your findings and how you did this. The point of our quality improvement projects are for you to apply something that was done successfully to your institution or clinic, and then somebody else can take what happened to you and all of the things that you learned and apply it to theirs. So we really want this to be a rolling forward and sharing success. There are some application deadlines that are coming up. Spring term, January 7th, is when you will, that will begin to go to review, and you will receive your determination letters. There is another one in the summer term, April 1. It is a rolling admissions process. Every term there is a new set of students who comes in. You will complete an online application. There is a short essay involved about mission, how you apply to your mission, and how what this is going to mean for you, and how to apply your DNP to your organizations, and how you're going to accomplish that. You will include your resume. There will be some professional references required, and of course your transcripts. There is a DNB pound experience in determining on when your last contact was with FNU, and if you were a current student. Depends on whether or not you do that live in person at Versailles or virtually, but that will be determined a little bit later on. We've already talked about the didactic courses and the project initiatives, and currently the credit hour cost is $705. So how to enter the DNP? You're going to complete that standard admissions application. External applicants who are NPs or CNMs will complete the same applications, and returning FNU, MSN, and PG postgraduate certificates grads can also apply for those using the same applications. These go to our admissions committee for review and for scoring to and recommendation for admission, and you will receive your letter then from FNU determining that you've been accepted or placed on a waiting list or not accepted if something was wrong with the background, but that's probably not the case since you're all in the graduate program now. All right, any questions for our admissions teams? Anyone want to turn on their mics? I can't. All right, no questions.
I'm sorry, I
Oh,
do have a question.
sure.
Sorry, I did have to step away for a second, so I apologize if I missed this. If we are currently in the program, are we able to go straight through? Like, can we apply while we're in the program?
You cannot.
Um, we
This
cannot.
this is Dr. Jefferson. In
Okay.
order to um, for the DNP program, we are a postmaster's DNP program currently. So what you will need to do is you will need to finish your MSN degree and take your certification exam because you need those two things. You need to be certified because when you complete your application, part of the application materials requires that you submit proof of your certification and your licensure in whatever state you're in.
Okay. Okay. Thank you.
You're welcome.
I have a question. Um, I take my national certification exam next week, and if I pass, can I immediately apply for the DMP program and even possibly start in January?
Yes, so if you pass your certification exam and you are granted licensure by whichever state you're in, you don't have to be licensed in multiple states. You just need, I think, wait, you said you're in one of the Carolinas, right?
North Carolina,
North
yeah.
Carolina. So if once you take your boards and they send that to North Carolina's Board of Nursing, then North Carolina issues you a license number, then yes, you are free to apply.
That's going to take about possibly 8 weeks, I've read. So I can't apply until North Carolina gets my stuff.
Yeah, we need a license number. There we look up, all of the things in nurses as part of your application process. So it shows like all of your active licenses, and so we need a license in a state. Sometimes the Board of Nursing says that it's going to take X amount of time, but it can actually be a quicker process. It just depends on how quickly you get all of your documents to them.
Okay, thank you.
You're welcome.
I have another follow-up question.
Sure, Carla.
I'm in a postgraduate program, so I already have my CNM and am hoping just to continue through after I finish my psych program. So I think that I'm an exception who can apply before I finish up my psych program. Is that right?
That is correct
Okay.
because you already are
I have a
licensed
license
as an
number. Yeah.
APRN and you have a license number and a certif. Yeah, so you are good to go.
Okay, great. Thank you.
All right, any other questions? So, one of the things that people always wonder about is this project or QI initiative. We want you to know that you don't need to enter the program with that already in mind. We don't need you to have a project formulated or a plan of idea what you're going to do. We want you to come in maybe recognizing that there are areas in every practice in every institution that you don't just do perfect or well at, that you feel like you need to do better. That's what we concentrate on. It is not meant to be your passion project. So, for instance, you can't really start a baby-friendly program in just 8 weeks, that initiative. It is about taking something like you don't do depression screening when you should be, or domestic violence screening, that and you don't do that yet in your practice and you should be. It is taking those smaller initiatives and trying to apply them in that 8 week implementation phase. But we will make for sure that you are paired with an experienced faculty member who will take you and your small cohort. The cohorts usually are between 6 and 8 at the most people in a cohort. And we will take your cohort through that planning, the last 3 courses: planning, implementation, and um, dissemination, and that their job is to counsel you and mentor you, to give you feedback based on their knowledge. Now, expectation management is communication. You guys, we expect that everybody communicates back and forth, and that you're going to be able to work at your site and work on this problem while you're there. It is not something you can manage from afar. So you can't do this project if you're in North Carolina, and you can't guide this project in Alabama. You have to be physically on site working either as a volunteer or as a clinician in that practice. Um, Confirming your topic ideas happens at about in 850, which is after you've completed your didactic courses. We want you to begin to formulate those topic ideas, because the didactic courses do some assignments that will apply and help you when leading your project. So it's a good idea to start thinking about those kinds of things, but we won't confirm that until much later. Program of study decisions will be made with you have an academic advisor who will be assigned to you, and that academic advisor, and there's several of them, will help look at your individual needs and develop any program of study decisions that need to be made. Life, work, school balance is critical. I can't stress upon you. This is a doctoral program, and it is doctoral expectations as far as turning in doctoral level work. This isn't memorization. There are no tests in the DNP program, in the final program courses. This is important that you are able to establish a good work life and family balance, having good behaviors, exercise and nutrition, and doing all of those things that bring you joy. We hope that you continue all of that through the DNP program to reduce the amount of stress that any doctoral program or PhD program would naturally bring on board. Your sites will have to go through approval, and we have a credentialing department that is dedicated to the DNP program that will start the approval and compliance credentialing process. Usually that is in that 850 course. But if you are coming or thinking about coming from a very large organization like Kaiser, uh, government organizations like the VA, Indian Health Service, DoD. Those are sometimes very complicated sites to navigate. And if you are thinking that's where you're going to be working and getting a job, we would love to speak to you about that ahead of time, just to help get those processes started early. Some of the credentialing for VAs can take months to do. So we want that. Now, another good thing to talk with your organizations about, especially these larger ones, is the IRB, Institutional Review Board discussion. Some big organizations have all of their quality improvement projects and um, research projects go through that Institutional Review Board. And again, it can be very complicated process and delay us. So knowing if they have that now and beginning to gather those documents so that you can see what we're going to need to work on in DNP 850, that pre-planning course, will be important. So just you can just start having those conversations. If they're not going to make you go through an IRB, we're golden. If there's an IRB involved, we're going to need to communicate very early on to begin working on how we're going to submit those forms to your IRB and get that done. They're all very different. Usually, we are hopeful that there is a um, expedited process for quality improvement projects since this is not research. And often we can get around the IRB by getting that expedited process. So these are just some beautiful quotes from Henry Ford. If I had asked people what they wanted, they would have said faster horses. This is not fast, guys. This is slow, and we want you to really um, learn and engage in these courses. These are not memorization courses like I am going to pharmacology, I'm going to learn all these medicines, all their risk benefits, alternative doses, bad things that can happen kind of courses. These are courses when you have to apply what you've learned, leadership skills. You're going to be navigating staff and getting them to change their behaviors, which is not easy. So it builds on everything builds on the next course, the next course, the next course, and it does not feel like it's very fast. You cannot rush through this process. So things to consider as you plan ahead. Do I have a potential clinical site? Are you working? Should you implement at your workplace? And we encourage you to implement at your workplace. Having an established relationship with the people who you are going to be leading through change is is literally imperative to success. Going in as somebody who they don't know and who does not know their site is very difficult. It's not impossible, but it is difficult. So if you can implement in your APRN role, beautiful. If you have your APRN certification, but you don't yet have a job, we can do it in the RN role, but you would have to remain in that RN role through the remaining 4 courses. You would not be able to suddenly take on an APRN job and stop your RN and begin somewhere else. It has those 4 final courses. We want you to be in a comfortable position and having been at the site for a while. You can volunteer at a site, but it is also very challenging because now you have to volunteer at a site and maintain working where you're already at. And when we talk about work life home balance, that is an incredible challenge, but it can be done, and we can help you to do that. When will I be starting a new job as an advanced practice nurse? Transition to an APR practice is challenging and does not always occur right on schedule. If you already have a job lined up and you know where you're going to be as an APRN, I would encourage you to be in that job and working for at least 3 months before we get to the project courses. It is much easier when the staff know you and you know what the true problems are. So I would never encourage anyone to start a new job and this DNP project courses at the same time. It adds a whole nother layer of frustration and anxiety for you. So if you can arrange not to let that happen, that will benefit you. Do I anticipate any major life events? So it's a stressful, your doctoral program is going to be stressful on top of itself. So if you can work around scheduling a big move to another, state or another institution or practice, I would think about that as you're planning when you're going to hit those um, project courses. Growing your family, boy, they're really hard to do. And because you have to be consecutively in 8 weeks in during the project implementation, have a baby in the middle of them, going on a cruise in the middle of them is really not, can't be done. So get that family out of the way if you can, or wait a little while. If it happens, it happens. We take a step back, take a pause, But if you can pre-plan it, that's awesome. Now, giving for a loved one, um, is gonna, that's all a very individualized, but it does add another layer of complication. So we just want you to be in the perfect scenario to go through this, but we realize life isn't perfect and that these things can't always be anticipated. All right, work-life schedule. So we've talked about this already, is we want you to be working while you implement this project. So it's meant to be done on the patients, with the patients that you see in the date that you're working. So we don't expect you to work a full schedule and then come in an extra 3 days and do your project on that. Sorry. An idea, let's take depression screening for an example. If you're doing depression screening, it gets applied to every patient in the practice as they come through the door. Everyone gets depression screening, and then you follow up during the course of your visit that day any patients who scored positive on a depression screen, and that becomes part of that visit. The same thing is if you're doing advanced care planning or if you're doing domestic violence screening, anything like that is meant to be done right there in real time. So we don't want you to have to work extra to make this happen. The data collection, the data analysis does occur after hours and on your own time. We've had some beautiful spotlights, and you can read about these on the home page as well, on the portal page. You can see about very successful students who have gone through to get their DNPs and what they've been able to do with that. As you know, birth centers are and have always been a great love from Frontier Nursing University, and so they do highlight some of these beautiful birth centers that have been established. The distance between who I am and who I want to be is separated only by my actions and words. Isn't that truth? There will be obstacles, there will be doubters, there will be mistakes, there will be hard work, and there are no limits. We agree. We're here to support you in all of that. And we do want to see you come across our stage, allow Dr. Jefferson to put that hood on you, to be hugged and shakes hands with all of our faculty at the end as you step off that stage. And it is a major accomplishment, and we want your family to attend your graduations and to hear about the good things that you've done and to celebrate. What a good example for your children and family members. You can do it. Many people have done it before you. All right, for additional questions regarding financial aid and FNU admissions, you can find these contacts on the portal page, but you can also just snap a picture with your phone right now and get to those if you'd like. Leave it here for a second. All right, any questions for us? You all are amazing, and I'm very thankful that you attended the session. Please reach out. It's kim.couch@frontier.edu. You can find me in the listing of faculty members, and you can see my contact information there if you have further questions. Please reach out to either Dr. Jefferson or I via email, and we'll be glad to set up a time to meet with you individually if you'd like to meet for any specific questions you have about your institution or your project idea or whatever. So thank you for attending, and I look forward to seeing all of your applications come across our desk, and we hope you decide to stay with us and continue on.